Welcome once again to our third Q&A session. One of the most common things that I get asked about is how to deal with sensitive teeth. Well, there are a few reasons that you may have sensitive teeth. One, it may be due to gum recession, especially if you experience the sensitivity after having something hot and cold to drink or eat. This is most likely due to incorrect toothbrushing with a hard brush. On the other hand, sensitivity can be caused by gum disease, where a lot of plaque has been left on the gum line and not cleaned out properly. So my main message for preventing sensitivity is to brush thoroughly and properly with a soft brush, or better still, with an electric toothbrush. There are several things that you can do to help with the sensitivity. You can use a desensitizing toothpaste like Sensodyne, and you can use it like an ointment also, and place the toothpaste onto the gum line and leave it on overnight after brushing. Fluoride mouthwashes is also a good idea. However, you need to be aware that if the sensitivity lasts a long time, or if it becomes a toothache, you need to talk to your dentist to make sure that you do not have a cavity or that you do not have an infection of your gums or your teeth. In these unsettling times, we do notice people suffer from ulcers more often than normal. This is because ulcers tend to be exacerbated by stress. Ulcers can be rather painful and debilitating. To help relieve the pain, you can try putting Bonjela on it or using warm salty water or antiseptic mouthwash to rinse your mouth. To prevent ulcers, it's best to make sure your immune system is tip-top. So it's a good idea to take some vitamin supplements and keeping yourself well hydrated. Another thing that can happen in these stressful times, especially in young adults, is problems with their wisdom teeth. In mild cases, you can control the discomfort by cleaning the area really well. You should also get these small angled toothbrush, like interspace brush, to gain better access at cleaning it. This is an interspace brush. You should also try and rinse with warm salty water or antiseptic mouthwash like Corsadil. Taking painkillers may also help. However, if the pain is very severe, disturbing your sleep, or if you feel the area is swollen, then you may have an infection. So it's best to contact your dentist and he may be able to prescribe you with some antibiotics to calm it down. Thank you for watching.